All right, my Take 5 series. I am super excited to be here with Jeff Bedard, who is the CEO of Crown Laboratories based in Tennessee. And from what I understand, their offices have been open in Tennessee, but their aesthetic division is closed down. We'll get his thoughts on that. So Jeff, welcome to coming on Take 5. Can you please give us some insight into Crown Laboratories? First of all, tell us a little bit about the products that you create in the aesthetic world so everyone out there, listeners, knows what that is.
Yeah, first, thanks, Steve, for having me on board, and good to see you again. So the aesthetic world, we entered it in a meaningful way when we acquired Bellis Medical in September of 2018. So most people know us from SkinPen, the microneedling device that was the first FDA-approved device in the U.S. And then we also have a portfolio of other aesthetic offerings, PRP, through our ProGen Advantage system, as well as skincare and the microneedling.
Okay, so along those lines, SkinPen is a very popular product in my office, and I know it's a product that, as I think about it, do I have to worry about aerosolization of that product, and with this new post-COVID world?
You know, you really don't. I mean, depending on the depth, there's not a lot of blood. It's more of an inflammatory type. Microneedling is not really something you're going to need to worry about the blood getting into the air and somebody breathing it in.
Okay, that's good to know. But that wasn't one of my 5 questions. So
yeah, it's a bonus question, bonus round, right?
You're getting 6 now. All right, question number 1 is, how has COVID changed your company?
Well, we're really a tale of two cities in many ways. So on the aesthetic business, we were on our way to have a record-setting quarter. We had just moved our PRP franchise from a Chinese manufactured PRP system to a US-based system. So we were launching that in February. We had our full field force out there and everything was going great. On another part of our business, the beauty business, we're heavily involved with spray tanning and sunless tanning, our Vita Liberata franchise. Most of that's done through salons and spas. So initially in March, we started the month with a bang, and then all of a sudden, medical practices like yours and all your colleagues, and the spas and salons closed. So we went from great revenue to 0 overnight. Now the other side of that is we're in therapeutic OTC and manufacturing. So our products like Blue Lizard and Panoxyl and Sarna and Zeazorb, Kerry Lotion have continued to do well and actually grown during this time. And then our manufacturing facility.
Why are they growing? Why do you think they're growing at this time?
Well, I think, on the sunscreen piece, the Blue Lizard piece, everybody's still outside. I mean, if you look at people's Instagrams, they're riding bikes, they're going on walks, and of course, protecting your skin from the sun doesn't just stop during a pandemic, right? The UV doesn't say, well, we'll take a break right now. So we're seeing good uptake with Blue Lizard, good sunscreen use. Panoxyl, stress, acne, we're the #1 acne wash in the U.S. And I think that stress causes flares and people are buying that. Our online business through Amazon is up 500+%. I mean, so a lot of people are spending time buying what they view as necessities. On the Kerry line, our Kerry products, which are moisturizers, are up hugely, which probably is because so much hand sanitizing and hand washing is going on. So those are the benefits.
So it's a diversified company in this time period.
Yeah, it is. And then we're entering in a meaningful way hand sanitizing manufacturing. We're going to be at capacity to do 12.5 million bottles a year. We just signed an agreement with Purell to do 8-ounce hand sanitizing Purell product for them. And then we're going to come out with some innovations around hand sanitization.
So is that something you can get to our aesthetic offices when we're back up and running?
That's our plan, Steve, is to provide that little piece of PPE for you guys. We don't make masks.
Something new that Crown has taken on within this COVID crisis?
Yeah, so, necessity is the mother of innovation is often said, right? And we didn't do hand sanitizers. So to give you an idea, we had a alcohol permit to allow us 5,000 gallons annually to use in some of our products. Our new permit now allows us 1.8 million gallons a year. So we're going to be a meaningful producer of hand sanitizers here in the near future.
So is Crown a different company, Crown Laboratories, after COVID?
It is. Well, one of the things that we're looking at, and one of the one of the things that I think we're all going to learn is how do you prepare for the next disaster? How do you make sure that you stabilize your business practice, your medical practice, and your companies? And diversity and being able to be nimble and change strategies quickly is the lifeblood of entrepreneurs. You and I are entrepreneurs. We know what it takes to be successful, and you have to be able to pivot on a dime because you never know what the world's going to throw at you.
Yeah, isn't that true? The black swans. All right,
Yeah.
I kind of gave you a bunch of questions, so I'm going to skip to question number 3.
Yeah.
And do you think the aesthetic patient has changed?
It will. Look, the first thing that the aesthetic patient is going to do when your practice is opening up is check their bank account, make sure they're stable, right? Do I have a good job? Do I have the income to be able to dip back into aesthetic services? And then the big question for them is going to be, how deep do I want to go? There's some people that may think that this is a perfect time to have more invasive procedures done in your office because they're working from home. They're not going into an office. They can recoup there. On Zoom, you can help yourself look better. You can kind of hide those things. So there's one train of thought there. And then there are others saying, well, look, I just want to get back on my skincare regimen. Maybe I want to do some less invasive things, some minor procedures, and they're going to enter the practice that way. The biggest thing coming out of that is once the patient's ready to receive services from an aesthetic practice, are you guys prepared to deliver it in the way that they're going to want to have it delivered to them? So is the patient going to change? Are they going to feel comfortable having more Zoom type initial consults and then you bring them in for major procedures? Are they going to want more concierge type services? Are they going to want you to deliver an esthetician to their practice, to their office or home, do a microneedling there, a peel there, a skincare treatment there? Are they going to want to buy private label skincare products over the internet, or are they going to require them to come into your practice? There's all sorts of things that we need to think about as an industry coming out of this.
All right, so question number 4, and this is an important question to many of my colleagues out there and to consumers. What are you going to do, Crown Laboratories, so that my practice is stimulated to see more patients?
Yeah, that's a great question, one that we're giving a lot of thought to. So there's 2 components that I believe are integral in emerging from this. Number one, we've got to help you with cash flow. So offices have been down for a long time. Your staff have been staying at home. And the last thing we want to do is walk in and say, hey, Steve, buy a bunch of cartridges for Skin Pen, and thanks a lot for getting us out of it. So we're going to extend terms. We're going to work with you to make sure that we are not a cost of more cash flow issues, but actually help you enhance that. The second thing I think is equally important, if not more, and that's around getting the patient comfortable with aesthetic procedures again. What are we going to do to draw that patient in? And we're looking at campaigns or programs that would allow you to provide a entry-level discount or some sort of package on microneedling and PRP that will give a call to action to the patient that allows them to come in, doesn't hurt you financially, helps you actually financially by us taking some of that burden to give a discount to the patient. So we're going to be rolling those programs out. They're not finalized yet, but we're working diligently to make sure that we're ready.
Do you think you go DTC or direct to the consumer, or will you work through us to market these programs to the patients?
You know, we're getting a lot of feedback from your colleagues, and some are saying, hey, give us the program and we'll outreach to our patients. Some of us are saying, hey, go on Instagram, be more, broad-based. But in reality, I think it works best going through your practice where you can reach out to your patients, offer a incentive to come in and get a treatment and work that way, because then it's really geo-targeted to you.
Okay, that's certainly, we're going to need that. The extending terms is a benefit to us, as the cash is tight for all of us, especially coming back, and we want to get the consumers in. So those programs are going to be well received by my colleagues. All right, question number 5, and your final question. What's been your guilty pleasure since the COVID has happened? Now, you're not completely isolated from understanding you're able to go into your office, but you've had, I'm sure, a lot more downtime than usual.
Yeah. The guilty pleasure, there's a lot of them. I think the guiltiest pleasure is is to talk to my aesthetic team and know that they have to work from home and I'm able to get away from the screaming kids and all the chaos at home and come to the office. The biggest guilty pleasure for me, and it's something I'm going to miss coming out of this, is I've got 3 children. I've got a daughter in PA school. I've got a son at Cornell University, and I've got one in high school, and they've all been home. And this is something that I never thought I'd see again, where we were all together and had family meals. So that was really the guilty pleasure of being able to go home and cook for my kids again, which has been a long, long time. So I had to pull those old recipes out.
So let me give you another bonus question because you just prompted me. What do you think your kids will think about this time period when they're adults? They look back 20 years from now. How are they going to view this time period?
I think it's going to be really set deeply in their mind. So for my son, he's graduating this year. He doesn't get to walk with his class. All the last semester things that he could have done, slope day is a big thing at Cornell University. That's gone. My daughter was set to start clinicals in PA, and now that's put on hold. And my 15-year-old is a great baseball player. That season was washed out. So I think, for them, they're going to see the sacrifices of the country. And I hope what they're going to see is a country that rebounded from this, and that the political divides that we've seen so rampant in our society the last few years, maybe we'll come together, and maybe that'll be the thing they'll remember most.
It's really interesting. Those are great answers. All right, Jeff, thanks so much for doing this. You gave a great insight into how Crown Laboratories is going to help us emerge from this crisis. And it sounds like you guys are well equipped. You're diversified. You're innovating with Purell and a contract and doing hand sanitizers. So all good stuff to hear from our Crown Laboratories. Thanks so much.
Thanks, Steve, and stay safe.
Okay, we'll talk soon.
All right, thank you.